Hi, I'm Carrie Garrett. I'm a voice and upper airways specialist speech and language therapist. So a voice and upper airways speech and language therapist works with people who are experiencing problems with their voice and people who may be experiencing problems with their upper airways. So it may involve chronic cough, sensation of a lump, or obviously the voice disorders and voice problems may be anything like fatigue, vocal strain, and vocal hoarseness. Most people who are experiencing voice problems, the common symptoms tend to be voice hoarseness, strain, experiencing changes of sensation and discomfort in the throat and upper airways, and finding that they can't do with their voice what they hope to do. So for example, if they're a teacher, they're finding it a real struggle to teach their class, experiencing strain and pain at the end of the day. Or if they're a singer, they might be cutting out on certain notes or finding they haven't got the vocal range. Or everyday people who maybe don't use their voice for their profession, they might find that they are not able to be heard by their children, they're not able to tell stories at night, they're not able to be heard by their elderly parents. It is completely individual as to how much voice problems can impact people. Signs that you might have a voice problem can include subtle changes that only you would really be aware of. Things like you might be experiencing a bit of a tickle in your throat and need to clear your throat more frequently. You might find that your voice is fading at the end of sentences or becoming a little bit crackly and rough or husky. Or it might be that actually you're not able to be as flexible with your voice. You might find that the pitch of your voice has become more monotone. Usually it's all down to what you have as a normal voice model and whether that's changed. So if your normal voice has changed, then it's definitely time to see if you can seek some help for it as well. So when a client comes to me for a voice therapy assessment, it involves some initial case history taking. Everything we do in voice therapy is we look at lifestyle and wellness, we look at the social aspects of how you use your voice, we look at your medical history, so any underlying complaints, respiratory complaints, for example, which might impact your voice production, and we look at the social side of things as well, so the context of how you use it, whether you use your voice for your job, what type of vocal demands, activities you have. The other things that we do in a voice assessment as well is when you come into clinic, I'll have a look at you producing voice. So it might be you have some speech tasks, it might be if you are a singer, some singing, and I'll have a look at what your body's doing, what your breath's doing, how your voice sounds. I might ask you to do some exercises and some little activities so I can really hear the voice quality and what your voice is doing. So when you come to Midland Health, I will carry out a full assessment, and based upon what you feel is right for you and what fits into your lifestyle and what is considered right clinically, considered right in terms of voice therapy perspective, we'll together create a bespoke therapy plan, and that might involve some lifestyle changes. It might be looking at how you manage reflux if you're experiencing any acid indigestion or reflux. It might be reducing the amount you use your voice or thinking of other ways you can gain attention or communicate with people to allow for your voice to rest. And it might include some what we call direct voice therapy exercises, which would be tailored, bespoke exercises for you so that we can work on helping your voice to function more effectively, and so that we're working towards a more sustainable voice for the future. So when people are experiencing a change from their normal and they're finding that things aren't working effectively, then that's where the voice therapist and voice therapy steps in. Whereas vocal coaching can be for anybody who wants to improve the communication skills, whether it's for public speaking, whether it's for voiceover work, it might be character acting, it might be more athletic sort of singing as well. And so that would be where voice coaching and vocal coaching comes in, where you're really trying to improve the creativity of the voice. Voice therapy at Midland Health is available in person, which I always recommend having an in-person session first because there's so much involved in observing and maybe getting hands-on as well in that first session to really help create an effective bespoke plan. But there is also available the online sessions as well, which are equally as effective once we've decided what we're going to do with your bespoke plan. So if you do have any issues with your voice and you would like to book in with Midland Health, you can book through Midland Health and you can arrange to see me in person or online. And the great thing about Midland Health as well is that we have ENT, ear, nose and throat doctors on hand as well. So there's a real comprehensive care package available through Midland Health.